Hi there. Yeah, we've all started. It's 12 o'clock. First of all, just wanted to say a massive welcome to everybody that's joining us. Thank you for taking the time to register and also join us today. We're going to be covering a lot of information. We've got a packed schedule in terms of workplace testing for COVID-19. Just a little bit on housekeeping. We are going to be presenting a lot of information, but we've got a couple of options if you have any specific questions you want to ask during the webinar, or if you want to sort of follow us afterwards and ask any specific questions. We do have on your Zoom, there will be a Q&A function. We've got a team in the background that are going to be collating those, and hopefully, if we have some time at the end of the webinar, I'll be putting those questions to our panel, and hopefully we can get the answers to you. If not, if we don't get around to that, then we will be following up after this webinar with any information. And there'll also be some contact details at the end should you have any emails or wanted to give us a call to discuss anything. So as I said, we have got a packed schedule. So without further ado, and in true Chris Whitty style, I think, can we have the next slide, please? Great. So this is what we're going to go through. So in a second, I'll be doing a brief introduction to our panel and also to both Hampton Knight and Medigold, and just talk through the journey so far of how we've got to this place where we're testing for COVID-19. And then the next few agenda points are going to cover everything you need to know about workplace testing for COVID. So we're going to talk about some of the considerations you need to bear in mind when you're looking at a testing program. Talk through some of the limitations and what you should expect from the testing, and then navigate some of those well, we've set a minefield. So yeah, basically some of the things that a test can do and the different tests that are available. Also, when you do get your results, what you should expect, and then from a workplace perspective, what you should do with those results. And then at the end, we're very excited to have some really good case studies, which will cover what we've been doing with the BBC, basically to make sure that everybody's favourite programmes are still being filmed and shown to everybody. So that's some really good information about how the testing can work in practice. So just to start off with the panel. So I'm Michael Wakeham. I'm Client Services Director for Hampton Knight. We're also joined by Dr. Gareth Williams. He is the Medical Director for Medigold Health. And we're also pleased to welcome Dr. Claire Fernandez. She's the Occupational Health Physician for Medigold Health, and also Interim Chief Medical Officer for the BBC. So our journey so far. Going way back, so 20 years ago, Hampton Knight were established, focusing purely on alcohol and drug testing within the workplace. It's something we've been delivering for across the UK for all that time. Within that gap between 2000 and 2017, we established probably one of the best collection services in the UK, both in terms of coverage and also response times. And we've also worked with a number of companies, many of you may be on this call today, where we've advised around introducing testing, policy, and also awareness training around alcohol and drug testing. In 2017, Medigold Health and Hampton Knight got together, and Medigold Health acquired Hampton Knight. Both businesses at the time were family owned, and there was a lot of synergies around our focus on customer service, basically a consultancy service, making sure everybody has the right information. And what we found is that sort of synergy and that working relationship has grown over the last 3 years, where we're in a place where we can mix both our very strong alcohol and drug testing service with the clinical governance and support with the Medigold family as well. But as everybody knows, something happened this year, which threw the normal bit of business into well, obviously the pandemic hit, so it changed everybody's thoughts on how to do things. And we were able to kind of utilise our collection service and our infrastructure with the clinical governance of Medigold, and pivoted very quickly to be able to provide COVID testing to our customers that needed it, where they needed to basically operate and try and run their business as normal. And as you can see there, we've conducted over 15,000 workplace tests now. And this has led us to develop a dedicated team that can help with everything from that initial conversation, some advice, guidance around your business and how you can do it, right through to our bookings team, the collection technicians, and then also the support afterwards in terms of reports and any guidance that you might need after that. So 20 years, but obviously we're here now and can support you with anything relating to COVID testing. I'm going to hand over now to Dr. Gareth Williams, who'll take you through the next few slides.
Thank you, Mike. Good afternoon, everybody. Appreciate there's a lot to go through and a lot to consider. I'm sure you've all got lots of questions that you're hoping to get answers for. And I'm just going to cover the testing element and some of the points that you need to consider when setting up a testing program. Firstly, I'd like to say that no test is perfect, and there are pros and cons with each test that I'll describe later. Even this morning there was some news. I'm sure some of you have read about the lateral flow devices and some of the uncertainties regarding that. I'll hopefully cover some of those issues, but it'll be difficult to cover everything. Some of the questions you may have thought about or come across yourselves are what should you be doing in-house in your own organisations. I'm sure we're all aware the government have been rolling out community testing into tier 3 areas, with examples in Liverpool and in South Wales to start with, and with coming out of lockdown today, they are talking about making these tests far more available than what they were before. I think some of the questions you need to think about is if you are going to set up a testing program, who should you be testing? If you are testing your employees, what about the contractors that you also use on site? Should you be testing those who've got symptoms or those who haven't got symptoms? I mean, the usual aim would be if people have got symptoms, they shouldn't be coming into the workplace in the first place. So maybe you want to direct those towards the NHS testing services, although, again, we can provide service and help with those who've got symptoms as well. A big question is about how often should you be testing? You'll see from Claire's later description and account what we have been providing to clients such as the BBC's weekly testing program. You may want to set up different frequencies and regimes and things like that, and we'll be happy to discuss that further with you. One of the important considerations is having the appropriate facilities. They need to be a clean work environment to stop cross-contamination and results, therefore, being false positives, for example, as a result of cross-contamination from COVID. I'll talk a little bit, like I say, about the different tests being used. You'll need to think about what test you should be using. You'll also need to think about your own organisational policies, thinking of things like diversity, equality, and those sort of employment law issues. And also things like confidentiality and data protection. And I know Claire will cover a couple of those points later as well. Again, what if an employee refuses a test? You'll need to have thought about that beforehand. And then also need to think about how you'll be using those tests. I have mentioned that there are some uncertainties about the testing, and I'd like to say that there's no perfect test out there, unfortunately. Even the gold standard Swab antigen test that gets sent to the lab, even that does have false positives and false negatives. And as a result, what I'd say is you do need to think about your general, this is part of a strategy of making sure your workplace is COVID secure and COVID safe. So you still need to do your COVID risk assessments. You still need to follow the government advice of hands, face and space. Yes, so having covered that little bit, test kits in general, just giving a brief outline about the different test kits. They are regulated by the Medical Health Regulatory Authority. All medical devices are regulated by them, and they must have CE mark, the KITE mark, which says they're approved and quality assured test kits. It's only MHRA that have approved point-of-care devices. These are the newer devices out there that provide the more instant testing compared to the lab test. Swabs taken and sent off to the lab. So MHRA have approved about four lateral flow devices for antigen testing, if I recall correctly. And what MHRA have described is that the POC tests need to be undertaken by a fully trained and qualified healthcare professional rather than the person being tested carrying it out for themselves and reading the results for themselves. Part of the reason for that is it has been shown that if a healthcare professional or supervised healthcare person carries out the test, you get much better results, more accurate results, and more reliable results. Government have turned around and said if the device is not approved by MHRA, they should not be supplied, and kits should not be supplied for self-test purposes. So people should not be carrying out this at home without any clinical supervision. Somewhat slightly different to, we do have clients that we provide kits to, and the individual self-sample. That kit is then sent to the lab to be analysed. So that is still okay to carry out. But the bottom line is that samples should be reviewed by somebody who knows what they're talking about and knows what to look for as far as results are concerned, and therefore interpreted by a trained, qualified healthcare professional. I don't want to get too complicated in the science of all this and statistics of it all. There are basically a couple of principles that need to be understood about the limitations of testing. This is what we call the specificity and sensitivity of tests, and this is tests in general. And you end up with what we call a positive predictive value and a negative predictive value. Sensitivity is the ability of a test to detect a disease state or condition. In other words, with COVID, when you get the test, is the sample that is showing positive a true positive, or is it a false positive? And then with specificity is the ability to correctly characterize absence of disease. In other words, the proportion of negative test results that are true negatives. There will always be some degree of false positives, meaning that you get a positive result when somebody hasn't actually got the disease. Of more concern probably in the workplace is the false negatives, whereby you get a negative result, but that person is probably an asymptomatic carrier of COVID. They've got the disease and they could be spreading the virus around the workplace. And even though you've tested them, you will get a negative test. As that slide indicates, the lateral flow device, I'll explain a little bit more about that in a second. The sensitivity of that is open very much to question and debate, and that was what came out in the news today about a local authority up in the north of England advising healthcare providers not to use the lateral flow device for this test because of concerns about the sensitivity. The other concern about that is if there is a low prevalence of the condition in the local population, then having a false negative result is more likely to happen. That 60 to 80% is based upon it. 60% if somebody was to take their own sample for it to be read by the healthcare professional, but if a healthcare professional or a lab analyst was to take the sample, those results can improve up to 80% plus. As I've described there, you can get false negatives, which would provide false reassurances, but that can be mitigated by repeating the testing either a few days later or as we've been doing with the BBC on a weekly basis. Next slide, please. So I'm going to talk now a little bit about the different types of testing. And antibodies, again, going back to sort of O-level biology, if people can remember that. Antibodies are produced when people are exposed to sort of viruses or bacteria, and they help fight against the disease. the test detects the presence of antibodies against COVID-19, which suggests that somebody has had the infection in the recent past. In the initial stages of developing testing for COVID, the only way of testing for antibodies was to take a sample from the vein by a healthcare professional, a phlebotomist or nurse or somebody like that, and sending it to the laboratory for testing. That's obviously a time-consuming process and quite costly. And at the end of the day, we still, what are we now, sort of 9-10 months down the line from COVID? Well, actually nearly 12 really, since it started in December back in China. We are still not much further forward in understanding what does a positive antibody test mean. How long does it confer immunity for? So at the end of the day, there's currently no strong evidence to support antibody testing, and particularly in the workplace. Most antibody testing is currently being done in sort of for research purposes and also within the NHS as part of that research. Next slide, please. So as well as more recently, as well as the taking the blood sample from somebody's vein and sending it to the lab, the rapid flow devices have been developed, which is something similar to if you pregnancy test kit type style device, whereby a finger prick blood sample is taken and dropped onto the device. And again, that can produce a result in about 15 minutes compared to sending it to the lab, which can take a few days. Again, this is the purpose of this is to detect a recent infection. So the positive result would tell you that somebody's recently had the virus, but it doesn't necessarily confer that they've got immunity, and it wouldn't tell you that they couldn't become seriously ill again, which is where the uncertainty lies with these sort of devices and the antibody screening methods. If somebody does do a test along these lines, they would still need to follow the guidance of all, safe working practices, social distancing, and everything else that follows on from that. So at the moment, there is no strong evidence to support rapid antibody testing in the workplace. And at the moment, we are not recommending that as a strategy using these sort of kits. I think in a few months' time, the tests may be better developed, their accuracies may have improved, and we may understand a lot more about the immunity and what do antibodies mean and how long will people remain immune for. So there may be a place some months down the line, but we're not there yet with that. Next slide, please. I'm moving now on to the antigen testing kits. The antigen is that part of the virus that the test looks for. And there are various ways of looking at this. So the antigen PCR swab test, which is sent to the lab, looks for part of the virus itself, and that is what gives you the positive test. Currently, it's thought to be the gold standard. It's the most accurate test by far. It'll detect that somebody's currently infective and has got the infection, even if they are asymptomatic. And the sort of sensitivity and specificity of these tests will indicate about 99% accuracy, if not better than that. Again, as previously described, these tests should only be under the guidance of healthcare professionals, and the labs that these tests are being sent to should be UCAS accredited. And they will have their own quality assurance processes and things like that. The test itself doesn't take long. It's as is demonstrated on the slide there, a nasal swab and a throat swab that is then sent off to the lab. One of the sort of issues, well, there's a couple of main issues with this type of test is although the test is relatively simple, albeit somewhat unpleasant to take and only takes a few minutes, getting a result back from the lab usually would take about 48 hours or so. So there is a time delay to getting the results from this, and it is quite a costly exercise to undertake, especially as part of a program where you may want to be repeating things on a weekly basis. The costs quickly escalate. So it is quite an expensive option, but we do have clients who are quite happy to provide this service, because that's up until very recently, this was the only way of testing in the workplace. Next slide, please. So I'm now going to talk about the rapid antigen testing, the point of care device, or also called the lateral flow test. And the picture of the actual device is there, which is why I'm saying it looks similar-ish to a pregnancy test. Again, it's the same as the other antigen test. It's a nasal and throat swab that's taken. And then the swab is mixed into a buffer solution, and the buffer solution is dropped onto one end of that test device there. And then, as you can see, you've got the two coloured lines on the device, which will indicate, well, I said two coloured lines. If there's one line, it means it's negative. If there's two lines, usually it means it's positive. The beauty of this test is you get results almost instantaneously, 15, 20 minutes. Some devices do take 30 minutes, but compared to having to send something off to the lab, it is a lot quicker. These devices are also a lot cheaper because you're not incurring courier costs, lab costs, or anything like that. They don't need to be sent to the lab and can be read by the healthcare professional on site. One of the concerns, as I've mentioned already with these devices, is how reliable and sensitive they are. They do have high specificity in that it's reported 98.9%, or some will claim to be even higher than that. So they're quite comparable in that respect with the laboratory PCR testing. The concern, as I've described before, was the low sensitivity, about 60 to 80%. Meaning that their ability to pick up positive tests in those infected is not great. So it does mean that you may get individuals who are asymptomatic still in the workplace that haven't been picked up for that. And as I described previously, the way around that is to keep testing people on a fairly regular basis. All these tests should be CE marked. And that provides you the quality assurance that they are reliable devices. Next slide, please. Most of the testings, kits, samples that we get, you'll get a reasonably clear result out of it, either you're negative or positive, or with a caveat, as I've mentioned, of you may get false negatives and still have some people who've got the disease, but the actual test result is usually reasonably straightforward and clear. We do occasionally, more so with the lab test, antigen test, we do occasionally get unclear or void or borderline tests. What that means, there's a variety of reasons for that. One may be that they didn't get enough sample to start with. There may be an issue with how it was handled at the laboratory or whatever, but at the end of the day, that is an inconclusive result, meaning it's not possible to say if the person has got COVID or not, and the recommendation there would be to retest. And there's some guidance on that slide about how quickly you should retest them or whatever. If the antigen swab test that's sent to the lab is inconclusive, then people will still need to self-isolate until they get a result back, whether it's negative or whatever. One question people may ask is thinking about the antigen test is I've forgotten what I was going to say now, is if you get a positive, that's what I was going to say, if there's a positive fast flow device test, because of the slight concerns about the accuracies of these tests, what our recommendations would usually be is that is followed up by an antigen test sent to the laboratory. The reason, like I say, for that is the uncertainty about the reliability and accuracy of the test. And on top of that, we'd need to report it into the NHS system, Public Health England, for the track and trace. And also, if you get a positive fast flow device result, you may be keeping people at home unnecessarily, but they'll have to stay at home until we get the positive swab antigen test. Next slide, please. So I'm going to now introduce Claire, who will be able to provide you with some further advice, and as the slide says, bring it all to life, given the experiences Claire has had within the BBC and how the BBC have managed and handled their testing programme. Thank you.
Thanks, Gareth. So, my name's Claire Fernandez, and I'm currently seconded to the BBC. So, we at the BBC have been using antigen testing now for many months. So, I wanted to use the BBC and some of our programmes that are using antigen testing as an example of why we decided this was a robust and appropriate approach to take, but also how we went about this, so the end-to-end process. Next slide, please. So, we use antigen testing on a regular basis on a lot of our productions, but everybody knows Strictly Come Dancing, so I wanted to use this as our main example. So we began the initial testing discussions in June, when Strictly was due to start filming again in September. Now, we started firstly by testing the dancers, because they start their rehearsals earlier with the group dances, and they then formed a bubble where they had their initial test and then stayed, once it was confirmed that everybody had tested negative, they stayed in a hotel for the remainder of the time where they undertook their rehearsals. So phase 2 was when the celebrities come in, and this then introduces a kind of host of things that we can't control. So firstly, we could control the dancers by keeping them all in one place, but the celebrities, for example, are working on lots of other shows, were living their normal lives at the time. So we started with a round of testing, firstly for the celebrities, 48 hours before they entered the second stage of the rehearsals with their dancers. And then secondly, once they'd started rehearsing on a weekly basis, we tested the dancers and the celebrities regularly. So this was either on site, or for some of the more high profile staff members or those that lived further away, these were individual requests, so such as doorstep tests. And we've done that, and we continue to do that on a weekly basis as Strictly goes on. So next slide, please. So why did we decide to do this? So specifically within our productions, an approach was needed to support the resumption of the production activity, specifically those that unavoidably requires interaction within the social distance boundary. And it's really easy to see how Strictly is an example of this, and to appreciate how this production couldn't continue without unavoidable close contact, without very major changes to the programming. So due to the need for this close contact, we decided to use antigen testing as an approach where other mitigating factors were not feasible. But this still remained in addition to, rather than a replacement for, the more rigorous, wider risk mitigation and hygiene measures that were in place when the dancers and the talent are not filming or not rehearsing. So we created a process for deciding how and who should be tested, and we came up with ITV and Sky with the idea of a cohort where these members of the production would be as small as possible, and these were the only people within the production that unavoidably needed to be in close contact with each other. So broadly speaking, you could see this would be the dancer and the celebrity, but also included some members of crew. So the guy or girl that holds the big fluffy muff thing, I found out that they actually go pretty close sometimes when they're trying to get the sound. And hairdressers and makeup artists is another example of those who were included. And it also, and some of our other shows included things like chaperones for our child members of cast. And we tested once a week to decrease the likelihood that somebody with the virus would be within the cohorts. And as Gareth has mentioned, so the tests show they're only good for the period of time that you test. They're not good for 3 days down the line. So it was important to be testing regularly to try and pick up both those asymptomatic carriers, but those who are pre-symptomatic, so those who are likely to get symptoms, but have a high enough viral load before they have symptoms to be detected as soon as possible to remove from filming to reduce the likelihood of spread within that environment, particularly given the nature of the close contact. So, and again, this was alongside our daily screening measures, such as temperature screening, the hand hygiene measures, the social distancing for the remainder of the time, and the face coverings, because whilst antigen or COVID-19 screening can reduce the risk, it cannot eliminate the risk. So therefore, all the sets, all the cast and the crew followed the government guidance when they weren't rehearsing or filming. So next slide, please. So the end-to-end process, and broadly speaking, the member of the crew goes to the place where they're tested, so the production site or clinic. They have their test, the test goes to the lab, and then the individual or the production gets the results. This can vary and has varied on some of our productions based on need, based on location, and Medigold have been very accommodating of that. And the pictures at the bottom are just mainly to talk about some of the control measures that are in place otherwise. So on the left, you've got the Perspex screens, and on the right, right at the back, you can see the production manager looking at all the filming going on. So that this person is extremely socially distanced from the rest of the filming going on in the foreground. And in the middle is an example of how this process worked. So Nicola Adams, who is a boxer, had sadly to withdraw from the competition when Katia, her dancer, tested positive within our testing regime. But that worked really well to keep her and others on the production team safe. So next slide, please. So the logistics, so how we went about doing this. So again, depending on requirement, the testing, the sampling officer can either go to a specific location, go to the doorstep of somebody's house, because obviously we don't want them to take the risk of having to go into somebody's house where we can't mitigate the risks, but also there is testing at our clinics. The nature of productions is a bit of a crazy beast. So, Medigold were very accommodating with some of the testing that needed to be done on short notice. The samples are very quick, and so therefore you can get quite a lot done in a day. Medigold also follows the standards required in the government guidance on third-party testing with regards to the facilities that they use, which Gareth alluded to earlier. They also work really hard, and they work 7 days a week to keep that regular, up-to-date machine working on those positive and negative test results. And the lab reports come within 48 hours with a very clear response of detected or not detected, with a regular information report to the client. Next slide, please. So I've talked about the end-to-end process on site when you've got somebody, an employee that's being tested. And I just want to talk about some of the other considerations around this, which Gareth talked about earlier, about how we went about the entirety of the process from, way before testing the first person. Because this is important. It's not particularly difficult, but it's important to get everything in place, particularly when you're talking about sensitive health data. So firstly, we undertook a risk assessment to determine the levels of risk mitigation needed and identified the fact that we would like to put into place further measures to help that aren't a measure of control, but do help to keep our employees safe. We then thought about the data that was being collected and the security of this and the confidentiality both for the employee, but also when giving out results and how that should be handled and communicated. So I say we, it wasn't myself, it was the clever people in information security and data protection that put into place a data impact assessment, which is essentially looking at how to minimize the impact of handling that data, and created a process for storage of those records. They then created a policy, as Gareth talked about earlier, considering who should be tested, why they should be tested, where they were going to be tested, what would happen and how the employee and others within that workspace, i.e. those close contacts, would be notified if there was a positive result, and information for the employee in line with government guidance on what should be done in the event of a positive result for themselves, for members of their cohort, but also thinking outside of the workplace and other people that they may have been in close contact with. We also then provided training for those handling the data within the production and what they should be doing with the results, because one of the things that came up is, well, I want to know the name of the person who's tested positive so that I can manage my own risk, and putting some secure information around why why we wouldn't be releasing the names necessarily, and who would be informed and why. And just a note then about Nicola Adams and Katia, that was managed very differently because of the consent provided by Katia to release that result to the public and the press. We then created an information pack for those on advice to be given for those who do test positive, including the support that was available for them afterwards. And then we decided when we were going to undertake the test, so that we, as I said, the result is only good for the time you've taken it. So realistically, you want to try and do it at the right period of time for you. And then we also thought about that process of giving information to staff around following the other controls in place, both in the workplace and outside, because one of the things that then sort of came up quite logically is, well, if I'm being tested, do I actually have to follow these controls that are in place? Because I don't have COVID, right? So those sorts of things were quite important. We then also thought about, the advice that would be then given to the employee. Should it be given that you're fit to work, or should it be that you're unfit to work, or should it be positive or negative? And then finally, the processes in place with the testing provider for those rare inconclusive results, but also we do know that some people remain positive even though they're not infectious for up to 60 days. So, arranging a process with Medigold on how those should be managed, as well as, the other considerations which Gareth has talked about with regards to quality assurance and the government guidance on that. And finally, about keeping the records and liaising with test and trace as needed when we do have the event of a positive result. So next slide, please. So bearing all that in mind, it seems quite complicated, but actually these resources here tell you everything you need to know about how you go about undertaking this sort of process, what you need to do with the data, what you need to do if you have a positive test or more than one positive test, which might be a workplace outbreak. And then the two that I'd really recommend reading is the top one, standards for employers and testing, and the bottom one, which is the frequently asked questions about testing in the workplace. And they will help to further consolidate some of the things we've talked about today. Next slide, please. So that's it for me. So I'll hand back to Michael.
Thanks, Claire. Thanks, Gareth. That was a really good overview of everything COVID related. Lots of information and good advice there. So I'm just going to just explain the slide that's up at the moment, and then we're going to move on. We've had a good response, some good questions. So I am going to have to bother you, Gareth and Claire, for a bit longer, just to try and help with that. So on the slide at the moment is just some contact information. Should you have any questions or any queries that you wanted to talk to us about, anything COVID related, either if you want to find out more about our service, Richard is the best person to get some information from. If you have any general clinical or operational inquiries, then there's an email address at the bottom there, COVID testing at Hampton Knight, that you can contact as well, and we'll get back to you as soon as possible. Just going over to some questions. I think the first one, which I'll answer because it was one of the first questions we were asked. This webinar is being recorded. We are going to be sending out a copy to everybody that's registered to the webinar. So if you did want to listen to us again or just wanted to recap on some of the areas, then you can listen to that. And also we'll be sharing the slides as well, because I know there's quite a lot of good information on the slides as well. So you can use those and have a read through. So just on a couple of questions. The first one is, can we offer help or support or even advice on workplace bubbles and how to approach that setup?
I'm going to ask Claire to answer that, as she's got more experience than me, having set things up with the BBC, I think. Sorry, Claire.
No, that's fine. So I think it really depends on what you're trying to achieve. So if you're trying to test specific groups, then yes, I think that I can provide some advice via Medigold on what we did to help with that. But certainly those principles can be talked through to get the best solution for you. It all depends on what exactly you're trying to achieve and what the type of workplace you are in is like.
Yeah, absolutely. I think just to follow on from that, I think every company has their own intricacies and operational requirements. So it is important that if you wanted to talk through that, get in touch and we can give you some advice and talk through the different options. Thanks, Claire.
Can I just add that it is important to understand what you're hoping to achieve through setting these bubbles up? What's the purpose of that? I mean, for something like Strictly, it's quite clear what they're trying to achieve there, to continue their production. And I think we'd need to talk, whoever's interested in this, with the client to see and understand what was the aim and objective of this, so we can certainly help and support with that.
Yep, excellent. There's a question here, I think it came through when you were speaking, Gareth, around who would be delivering the test kits and the testing. And the question was, can we be trained to carry out our own rapid antigen test?
The current advice is that it should be supervised by a healthcare professional. And I think by that it means that somebody, if you've got a large site with a huge number of employees on there that you want testing, then I think you'd need somebody on site or access to a healthcare professional to supervise all that. we do provide considerable training to our healthcare staff who go out and provide this testing, and on how to take samples, and also how to do these tests safely and maintain quality assurance and standards that way, as well as interpreting the fast flow device results and things like that. And they also have access to senior medical staff back on site, back at Medigold.
Excellent. We've had a flurry of new questions, so I'm just going to work through some of these now. One question, this is specific, so it's a company that looks like they have sort of rotating shift patterns. So they've asked, how often would you repeat the test for each employee, and how often they have a rotating workforce working shifts?
That's I mean, at the moment, it would be in discussion with the client, because obviously there is a cost implication to all this. Our usual process would be to test people weekly. I guess if people are on rotating shifts, how does that work around that system and that process? But again, we'd need to discuss that with the client specifically, how we set that up and how do we cover shifts and things like that. I don't know, Mikey, whether you logistically and operationally would be able to support any advice on that. Mm-hmm.
Yeah, I think logistically, our service is available 24/7. So if there was shift patterns, so you have night workers or people that are on rotating shifts, we can cover that. And I think, as we said before, it's trying to understand how those bubbles and what are you trying to achieve with creating those bubbles, and what could be done in that place. So yeah, definitely we can sort of support from a logistical perspective on that side. Another question which has been addressed directly to you, Gareth. So it might be it's around vaccines. So obviously the advice on this changes and it is being updated on a regular basis. But the question is, how will immunity success be measured? Will that be via an antibody test, antigen test, or something different?
To be honest with you, I'm not aware of any post-vaccine immunity testing that's been done other than on a research basis. I think that the plans the government have is the studies have shown 95% plus whatever, success rate with the vaccine, depending upon which one you're talking about. I guess there will be some ongoing research studies continuing to assess that, but I don't think there are plans on behalf of the government to assess people's immunity. Now, I hear what you're saying, and the question is, how long will this vaccine work for? Will it be 12 months' time? We'll need a booster? I honestly don't know the answer, and I think time will only tell. Mm-hmm. We're not in a position at the moment, I think, as knowing what the immunity success will be.
Thank you. There's a group of questions that we've had sort of focusing around cost and I suppose discussions around how costly it would be. There's a couple here which have talked about how many employees they have. I think just to respond to that myself is that with regards to costs, I think it's important that we do have this discussion with you directly to understand your business more, understand how many people, but also what testing is right for you. So we will get back to you on that. We'll talk to you specifically about your business and what you're trying to achieve, and we'll be able to provide costs that are specific to your business rather than talking sort of generally at this point. We've also had another couple of questions just around, I suppose, the logistical side. So one was about, do we cover the whole of the country? So yeah, we cover the whole of the UK. So we do have full coverage. There's one question here about, do we support businesses, universities? So we are supporting, and we are in discussions with a number of organisations such as universities and councils to try and support them in their testing programs. So again, yeah, we can support all organisations and businesses. So it'd be good to have a direct conversation if you needed further support on that. I'm not sure if we can answer this one. It might be. I'm not sure if there's any knowledge, but there's a question here regards to. It says, I believe NHS staff are carrying out lateral flow tests at home. Is this suitable if they are not being managed by a healthcare professional?
I don't personally know the details of what the NHS are doing and how they're setting up that programme or whatever. And it's the first time I've heard that NHS staff are doing this at home. I presume you, by this question, the questioner is aware of possibly, say, cleaners, porters doing it at home. I suppose the argument may be that they're being supervised by the medical director or a senior clinician within the organisation who has talked them through the process. They may have had a couple of tests being carried out on site to start with, and then subsequent to that doing it at home. I don't know the details of this, and I'm not sure if it's quite in the spirit of what's meant to be happening out there. But as we're all aware, there's lots of things happening out there with COVID testing that perhaps doesn't meet best practice. I'm not saying this isn't best practice. I'm just saying we've all heard stories of different things going on that, I mean, in the early days, a lot of testing was being done by all and sundry who had no healthcare experience or qualifications, for example. But if this is happening, my guess is it would be the individuals would have been talked through, would have had a couple of tests carried out on site by clinicians to start with. But like I say, I don't know the details.
Okay. Again, just a couple of questions that I'll answer. We've been asked if we provide a mobile unit. So the answer to that is yes, we do offer mobile units. We've got a couple, we've got a fleet of mobile units that we can utilise. So that's not a problem. Another quick question here. We will be sending out a copy of the presentation via email. So whatever email you use to register to the webinar, that'll be sent out. There is a question here on sort of more geared around high volume testing. So the question is, with the rapid antigen test, the sort of 15-20 minute response, is that the best option for high volume testing, and will the risk diminish with more testing?
I'll try and answer that best as I can. Yes, it probably is the best solution on the basis of cost and value for money and everything like that, because and the timeliness of it all. One of the big positives about the rapid antigen testing on site is that if somebody has a positive test, you can take them out of the workplace quickly, rather than wait for a couple of days whilst they're still in work, potentially and potentially spreading the virus. So volume wise, cost wise, it is going to be far more effective to use the rapid antigen point of care test. Like I mentioned earlier, I think the cost does rapidly escalate. Bear in mind, there are some basic costs. You know, the on-site healthcare professional has the basic cost of them is not going to alter much, but the actual testing kits and courier kits and things like that, when you tot that all up, the cost of an antigen swab test sent to the lab is probably at least 10 times, if not more, 15 times compared to a POC test, for example. So, yeah, I think hopefully that answers the question.
Okay, one of the questions again, just around vaccines. So, what's the thought process once mass vaccines are available? Will testing stop or be reduced?
I think I think it'll take at least 9 to 12 months for the vaccine to be completely rolled out. There is also the question of how successful will the uptake be, and there's all sorts of rumours of 40 to 60% of people only will take up the vaccine, and then you've got to start thinking about herd immunity, and is if we only get 50% uptake, is that going to be enough to stop this disease in its tracks? So I think the jury's out at the moment how long you'll need to carry on testing for. I certainly anticipate it being around for the next 6 to 9 months whilst the vaccine's being rolled out. Beyond that is a little bit uncertain, I think. It depends upon uptake, how quickly the vaccine, and to some degree the success of the vaccine program.
Mm-hmm. Great. So we're getting flooded with questions, which is great. I think we're just coming to the end now. We've got sort of 5 minutes left, so I'm going to try and cover off maybe in the next couple of questions. And then what we'll do for anybody that you haven't heard your question or we haven't covered it, we will be able to get back to you and cover those off. One of the questions here, again, more logistical. So it's asked, how soon can we implement this program at workplace? And are there any minimum basic numbers of tests required? I think just on this, there is no minimum test required. We've been testing not just workplace, but also for people that are travelling as well, which are either individuals or small family units. In terms of how quickly, the general rule is, as obviously we've talked to you about what you're looking for, what the options are there. And then in terms of rolling it out, we've got the infrastructure in terms of collectors and being able to carry out the testing, so it is fairly quick, but it's just making sure that from your business perspective, it can be rolled out effectively and work with your operations as well. Just working through, seeing if there's any ones that kind of multiple questions that are asking the same thing. One here just regards the sample process itself. Is taking a sample easy? I suppose this might relate to the self-collect kits. I would imagine that taking a test result is very much based on the quality of the sample test taken.
I mean, if we're talking about the antigen swab test, and that's the one that we usually recommend, well, the swab test is what's needed, whether it's the rapid test or the sent to the lab. It is a bit of an unpleasant test to take, and we offer sort of two ways of doing that. One is sort of a supervised way where the person can take the swab themselves, or if they're not happy doing that, the clinician will take the swab. The concern is that if the person takes the swab themselves, they will tend not to go in deep enough or take sufficient sample. And you're quite correct in that, as I think I demonstrated earlier with the statistics of, only 60% specificity, I think it was, with self-testing, those taking their own samples compared to 80% with healthcare people taking the samples. So there is a difference. But that can be mitigated, as I said, by repeat testing. But you are right, whoever the question was, that the quality of sample taken does depend a little bit upon who's doing the test and how experienced they are and things like that.
Mm-hmm. Excellent. I think what we'll do there is that, like I said, the questions are coming thick and fast now, and unfortunately we won't get a chance to cover them all off. I'm going to just finish up with one last question. It's just popped through. Can you supply rapid antigen oral swab testing, or is this not available yet?
I'm guessing this relates to the saliva test. Is that what it is? I'm a bit confused with that question, because it says oral and then swab, and I'm a bit unsure. I know there are some saliva tests out there being researched and looked into. I'm unaware at the moment. I know they were doing some research in Southampton with saliva test kits and things like that, but I'm not aware that is available on the open market yet. Mm-hmm. I may be wrong, but I'm not aware of that. I'm sure it will be in weeks to come, but yeah. Yeah,
excellent. Well, I think we'll stop the questions there. Massive thank you to both Gareth and Claire for your presentation and also follow-up questions. Really appreciate your time on the panel. As I said, just to reiterate, you've got all our information on the slide at the moment if you wanted to contact us separately, but we will be covering off the questions that have been asked, and we will be sharing both the slides and the video of the webinar to everybody that has registered. So thank you very much.